If private health insurance was made illegal and replaced by a single payer publicly funded system, what would happen to the people currently working administrative jobs in the healthcare insurance sector? Well, it goes one of two ways. It may be that the new healthcare system will need just as many people, and it will just be same job, different boss. Rather than working for the private sector, they will be working for a public system. I don't think that's the way it would go, though. A lot of private healthcare administrative roles involve figuring out payment logistics between the hospital's patients and insurance companies. It is likely that fewer people would be necessary to cover these roles related to payment in a single payer system. Now imagine if your job was to dig holes and then fill those holes back in the next day. Maybe it's not your dream job. You don't totally understand why the job needs to be done. However, if you're paid to do that job, your livelihood depended on it, and someone took that away, that sucks. Losing your job could mean you fall behind on your mortgage payments and lose your house, or fall behind on your rent and get evicted. If a politician says, I don't care that you lost your job because your job was pointless, that politician will lose supporters. Saying you don't care about people losing their jobs is akin to saying you're indifferent about that pain. Private insurance providers have to hire a ton of administrative roles in order to function. They are paying agents to talk potential clients into buying their plans. They are paying liaisons to negotiate contracts they have between hospitals and doctors. They are paying customer service representatives to talk clients through copay and deductible schemes. The list goes on. The money to pay for all those employees has to come from somewhere. So let's go back to the hole digger example, but flip it around. Now instead of getting paid for digging holes, you are paying someone else to dig holes and fill them back in. It is expensive to pay for all that digging, but you know that they really need this job. There must be some way you can stop having to pay this person to dig holes without them losing their house. So private insurance actually does provide a service, and that service is allowing those who are willing to pay more to get more comprehensive health care than those who are not willing to do so. So the question we should be asking, is that service worth the cost? It's difficult to measure exactly what that cost is, but you can get an idea by comparing countries that prioritize providing the service, like the United States and Switzerland, to countries with similar health outcomes, but a smaller range of coverage options, like Germany and Canada. The cost of giving more options is so high that for a lot of people it wipes out the benefits to buyers on both sides of the spectrum. Those who want more coverage would be able to get a similar level of care at a significantly lower price, while those on the other side who would get a far more comprehensive service at a similar low price. I didn't ask you to think of yourself as paying someone to dig holes and fill them back in to make you frustrated that you're paying someone to do a task that seems meaningless. I want you to ask the question, why are we paying for these tasks? No one really benefits from private insurance on the buyer side, but the seller side is a different story. The reason private health insurance is so lucrative to sell is a bit technical and would require a separate video to really dig into, but the simplified version is insurance benefits from economies of scale. This leads to a market with few sellers and high barriers to entry leave the sellers with a lot of market power. And that market power allows the insurance companies to charge prices to customers based on willing to pay rather than the cost of the actual product they are providing. So I liked the insurance rep who walked my office through the different health plans my coworkers and I had to choose from. He was friendly and upbeat. I liked the customer service representative who helped me figure out which doctors were in my network. She was very patient with me. These people are nice and hardworking, but the value they provide to insurance companies isn't actually to make the healthcare system easier to understand. In fact, it is quite the opposite. If you understood the healthcare system better, you would see what a raw deal private health insurance is. It may be easier to pretend we don't know why we pay people to dig holes and fill them back in. It may be easier to follow the fake reasons that charismatic politicians make up on behalf of the billionaires who fund their campaigns. You can say, out of sight, out of mind, but you've heard the whispers, and deep down, you know what you would find at the bottom of those holes if you dug them back up. When the healthcare system prioritizes making everyone pay as much for coverage as possible rather than making sure everyone has the care they need, you will sometimes end up charging people more than they are able to pay for. And thousands of Americans die every year because they delayed seeking treatment that they weren't able to afford.